again, I want to thank all of you for your work. It's just amazing what we're accomplishing in these yearly meetings. Is a way that we're all getting to know each other more and we're networking more. And I'm really excited about today because I think there's some real good opportunities for us to have some really good networking happen today. Buddy will come out shortly. The focus of this year's event is a little bit different than other years. We're now having speakers that are much more directly related to who we are and what we're doing and how we can work together beyond just today's meeting. I mean, there's a real opportunity for us to have a real working partnership as we move forward. So I really want to emphasize the importance of this, and your feedback in the evaluation will be really important, for us how this day goes. It's a big state. And Southeast Massachusetts is a big state, and it's easy to feel at times being a little tiny entity that's trying to do a huge amount of work. Our work is really, really important, and it is developing, and it's just so important, for all of us. So, Buddy's part. Oh, Buddy, you are available, so I will be.
Go figure.
You have a note from your mother. Okay, good. So I don't want to spend much more time. You've got the agenda in front of you. We've got a really good breakout session that is going to focus on housing and also the professional development of our roles as Citizen Advisory Board members and Citizen Advisory Boards. And again, the hope is that over the year, with Mark Bilton, are you here? Yes. Yeah, hey Mark. From DMH housing specialists, is that we're going to develop a working partnership with Mark along with some of our other speakers, which Buddy's free now. So I'm going to bring Buddy up here now, and he can introduce our speakers, and then on with the show. Okay, again, welcome, welcome, welcome. Okay.
Alan, thanks for covering for me. And appreciate, sorry that I had to take that phone call and kind of delayed us a little bit, but it's really great to see everybody here. So welcome to the 4th Annual Citizen Board Gathering. And when I look around the room and I think about the activities over the past year, I just want to note that we really have come a long way in the 4 years since we started to come together annually. And I think Alan's just described a little bit about our own evolution, about what we see this day being and how that's evolved. But I'm also just looking around the room. There are new faces. I've been aware of an enormous amount of activity across the Southeast from the citizen boards, advisory boards over the past year. So I hope you see this opportunity as a time to learn from each other and share ideas and kind of network. And I think that particularly to understand that you're not alone in this work of advocacy, and you're not alone in this work of supporting a robust and effective system of care for people with psychiatric illness. And so I thank you for your work, your time over the past year, and also your time today. And we want to kind of respect that, and I think offer to you that opportunity to talk and share ideas, also to hear from folks about sort of what some of the more important issues are facing us, particularly in the Southeast, as well as what can we do? What can citizen advisory boards do? Because I think it's a critical partnership between the department and the advisory boards, particularly in promoting awareness of mental health issues and advocating for the services and resources that will enable persons with mental illness to live their lives to the fullest in the community. That's what our mission is. And it is not something we can do alone. So I hope you get energized by being in a room with other people who are just as passionate and committed about this work as you are. There are several people I want to thank who have made this day what it is, worked a lot on the planning and preparation. Alan, the area board president and Cape Cod Psych Board member. Ben Kravitz, over here. You can raise your hand even, like Ben. Who's the area board in Brockton Psych Board representative. Sue McGinnis, there, back there, who's on the area board and Quincy Psych Board member. Jean Grandi, there we go, who's also an area board and Quincy Psych Board member. And Kim Anderson, who holds it all together for us through the year, works my office as the director of, the coordinator of employment and education. There you go. These are the people who really made this day happen, and I would be highly, highly appreciative. So I received some time to Donna Mosh, who is the president and executive director of the Massachusetts Association for Mental Health. As this planning went on, Donna reached out to us, and this just seemed like a great opportunity for Donna to be with us today, share a little bit about the work that she and her agency are doing on behalf of the department in terms of outreach and understanding, kind of getting input on the issues that concern us around mental health. So she's here today and present. MAMH is, I would say, the most influential advocacy organization in Massachusetts, and I would say New England. If I had, I want to, I'll say the country, but we'll at least give you New England. Incredibly storied history of advocacy, competency in representing the concerns of people with mental illness and their families on a policy level, on very practical levels, on an individual constituent level. Donna will call me and say, this is an issue that I have heard, we've got a phone call, is there something you can do about that? And we follow through. Donna has had, and I would say, what I would describe as an illustrious career in mental health, including significant leadership positions in both the private and public sector. She, at one time, was Assistant Commissioner of the Department of Mental Health in Massachusetts, and another time was Executive Director of the Rhode Island Department of Mental Health. And I think this event is ideal opportunity for Donna to attend. And at this time, I want to invite Donna to come up and just share a little bit about what you're doing, and it's great to have you with us today. Thank you.
Well, Buddy, thank you for that very generous introduction, and thanks to everybody for having me here today. I really do feel at home. I started my career in Massachusetts running a nonprofit organization that provided housing and community support services to people coming out of state institutions, and that was back in the mid-70s, so I date myself. But I was working very closely with the Department of Mental Health at the time, and got really challenged by people in the department, leaders in the department, that if I wanted to fix things systemically, I should come and work for the department. They really saw themselves as the agent of reform, and they were. And I accepted the challenge. So I spent 10 years working in the department, great years, probably my, really best professional years. And first as an area director, but back in the days when there were 42 areas. And then in central office, and when I was in central office, had the divisions of mental health and substance abuse, which was then called the Division of Drug Rehabilitation, and the Division of Forensic Medicine, reporting to me. But my happiest place was in the areas, and I prided myself on the fact that in the years that I was in central office, I visited every area. personally and met with people. And I often met with area boards. And I was so glad to hear Buddy use the A word as in advocacy, because my model for advocacy is what I grew up on with the Met Beaverbrook Area Board, who were this incredible group of people who helped to formulate policy in the area, helped to generate ideas about how we could better serve people, helped to start provider organizations. This was the 70s, and there weren't so many players out there then. And went straight to the legislature for us in a time when actually the commissioner didn't mind, Bob Oken, really didn't mind if we went directly to the legislature and got money tagged for the area. The good old days, as I call them. But I know why it doesn't make so much sense in some ways to do that way anymore, but it was in a time when the department was really trying to build itself and build its resources and its capacity. And the area boards were just so instrumental in shaping what became not just the mission of the department, but the mission and action of the department. And I'm happy to say that the Mass Association for Mental Health has a very aligned mission with DMH and with the areas. You know, our focus has been, since we were founded in 1913, on educating people about mental health and behavioral health conditions, and educating them about solutions or treatments and supports that are effective at helping people to recover. We have always had a strong belief in recovery, and that animates a lot of our advocacy to not only improve access to care and access to good quality and evidence-based care, but also to make investments in prevention and in promoting people's mental health and well-being in communities. Another part of what we've tried to do is really work at ending discrimination that's, you know, due certainly in part to the continuing stigma associated with these illnesses, but also other circumstances where too many of the people we serve and want to support find themselves in poverty and find themselves in marginalized communities, and the combination of that and the stigma about the illnesses creates even bigger discriminations and disparities for people. So MAMH has worked very hard over the years to try to push parity legislation, try to push equity in the distribution of resources around the state, et cetera. In the last couple of years, we've worked very hard on trying to make parity real. The law is there, but insurers were not really implementing the law, and we've tried to work in the legislature, in the courts, and in the administration to push people to get the insurers to comply with parity. And along with our partners in other stakeholder organizations, including NAMI and Health Law Advocates and Healthcare for All, and the Children's Mental Health Campaign. And we've had some success. The other thing we've been very aware of, and I'm happy to see the housing director for the area here, is that housing is probably the most important social determinant of your health and well-being and your mental health. And that without housing, the department can't do its job to serve people in the community. And housing has gotten so unaffordable in the Commonwealth. We were just chatting earlier about actually some staff I was talking to yesterday when I visited Gosnold, and the challenges they as young staff are running into trying to house their own families down in southeastern Massachusetts. But it's gotten so expensive that one of the things we've pushed over the years, MAMH has been active on, is developing a fund at DHCD that's dedicated to DMH clients that provides housing subsidies that are separate from the federal subsidies, so that people who might have barriers to getting access to a federal subsidy or just live in an area where there's a long waiting list, years-long waiting list to get a housing or rental subsidy, have another option. So we need to do a lot more than we are doing, but we're really committed to that work. And so I'd also like to take a minute to, I want to just say one more thing, and then I want to introduce Jennifer Earp. we're really privileged to be here today. I can't thank you enough for including us, and we are here to listen. As Jennifer's going to explain in a minute, part of our charge from the Department of Mental Health is to engage stakeholders. You all are stakeholders, people who care deeply about these issues and the mission, to engage them and hear from them what it is we at MAMH can and should be doing to support your efforts to bring alive the mission that we share with you. And I'm looking forward to learning from all of you today. So I would like to introduce Jennifer Erf, who's with me today. And Jennifer is the Director of Knowledge Dissemination and Technical Assistance at MAMH. Like me, Jennifer has worked in the Department of Mental Health. In her case out in Western Mass, she can tell you a little bit more about herself. And she's also, like me, worked in the world of research-based consulting and advocacy. She was Director of Training and Technical Assistance for the National Association of State Mental Health Program Directors, State Commissioners Organization, prior to coming to us. And she's going to be telling you a little more about our stakeholder engagement work. And I thank you.
There's not a lot more else to say except about myself, except the most important part. Like Donna, I feel really at home here because I have many years of experience serving on the Western Mass Area Board and serving as chair for some time, and also on the Hampshire Site Board. So I'm really committed to this work and in awe of what you've built in the Southeast area. I've been talking to Alan and learned a lot about some of the things you're doing, and this day is a fabulous idea that I hope you don't mind if I steal it and bring it back to Western Mass. I hope the whole state has a day like this. This is really important. As Donna mentioned, MAMH has a contract with the Department of Mental Health to support them in a broad range of education and training and program activities that they're working on, and we provide a range of support. One of the things that is part of that contract, but also part of our mission, is to reach out across the state and get a better sense from people who use DMH services, who are family members or loved ones of people who use DMH services, who work in the service system or who work in systems that connect with the public mental health system. So that, I think, probably includes all of you. Many of you are probably in a lot of those categories, not just one. We want to learn from you and share with DMH what you see as the strengths of the system, what you see as the gaps, what you think are the priorities or need to be the priorities for the Southeast area. At MAMH, we're also really interested in learning what resources, skills, knowledge you think you need to be the most effective advocates that you can be for people with mental health conditions and their families in the Commonwealth. So again, just to add my thanks to Donna's thanks for the opportunity to be here. We're just here to listen and learn from you today and share some of those ideas that you bring today with DMH, and also use that to help inform how we might be able to be of support and service to you in the future. So thank you.
So the next person I'd like to introduce to share some words with you is Beth Lucas, Assistant Commissioner for the Department of Mental Health. Let me get that right. Well, no, Assistant Deputy Commissioner for Mental Health Services. We're always flip-flopping around on these titles, so I do need to stay current. Beth has been with the department for a number of years, worked closely with her. Beth has really been at the nexus of, I think, most every fundamental change that the department's been involved with over the last several years, and in particular as the landscape of mental behavioral health services and substance use treatment changes and evolves in the state of Massachusetts in more integrated ways and new models for the management of these services in the community and care coordination. Beth has been in the back room on all of those issues and working out a pathway for the department. And really happy that Beth could share a few words with us. Thank you.
Good morning. Thank you for having me here today, and on behalf of the Commissioner, I want to express my gratitude to all of you for the significant contributions that you make to the department, but more importantly, to improve the services that we're providing directly to people using our services. I wanted to start by actually telling you a story about my summer vacation. This summer, my family and I had probably one of the best vacations we've ever had. We flew out to Phoenix and rented a car and did one of those national park trips. And it was amazing. The whole trip was absolutely amazing. But I wanted to tell you a little story about what happened in the airport on the way home when we were flying out of Las Vegas. And we arrived at the airport, and as any of you who have flown recently know, oftentimes you're interacting with a kiosk when you first get into the airport. And you have to input your information, and then it's going to spit out a boarding pass and tell you how to handle your baggage and so forth. So I do that, and this big alert comes up, and alert in an airport never feels good. And it tells me that of the 4 passengers in my family, that one doesn't have a boarding pass. And so I have to go on to the next screen, and I find out that the member of my family that doesn't have a boarding pass is my 11-year-old daughter, the youngest member of our family. So I've had a wonderful vacation, and I'm a little annoyed, but this is all going to work out. And spoiler alert, it did. We got on our plane, it took off on time, it landed on time, had completely uneventful except for a little turbulence. But the process I had to go through to get her a boarding pass felt really tiring and frustrating. The experience of being in an airport and going line after line, person after person. Well, we can't help you, but get through security. You get through all the security lines, you find another person. Well, they can't help you, but the gate attendant can. And you go through kind of this experience. And I went through, again, I was feeling really relaxed, and so I just kind of went with the flow of the experience. I had nowhere to go until my plane was due to take off. So finally I get to the gate, and the gate attendants finally show up a half an hour before the flight. And myself and another passenger kind of, you kind of approach the desk, and you kind of stand a respectful distance back, but waiting for them to catch your eye. And we're standing, and they're clearly annoyed that we're there. They're not ready. And the other passenger had gotten there just a little bit ahead of me, so he's standing a little bit closer. And so the gate attendant looks up, and she said, "Have a seat. It'll be a while." And he says, "Oh, that's okay. I'll just wait, because where are you going to go? And of course, if you go back to your seat, 50 other people are going to get in line, and now you're stuck." And so she goes back to whatever she's doing, and after a couple of minutes, she looks up again and sees him still standing there, and she goes, "Fine, what is it? I hate lines." Oh. Nice. And I've told this story, I've told many stories about my summer vacation since we went back, because it was a really great vacation. And I've told this story, and that line has kind of become the punchline to my story. Because you think about it, you're working in an airport. The entire experience of being in an airport is about lines. That is it. So to say to the person who's just doing what they have to do to get their needs met, "I hate lines," is kind of in that moment funny, amusing. At least that's how I kind of took it in the moment. But as I kind of shared the story since I've been back, the story's kind of taken on a different meaning for me, because I thought, in an airport, airports are not designed for our convenience. They're not designed to be customer service friendly. Some airports do a better job than others, but airports are designed to get people on and off planes as quickly as possible and in a safe way. And if they make people happy, that's great, but they know probably you're going to come back anyway, because you're going to have to fly at some point in the future. But healthcare is different. Right? Healthcare is fundamentally different. We have to be designed in ways that are welcoming, that are simple, that reduce the amount of time you're waiting. Because chances are, if you're waiting, it's not a matter of convenience. It's not a, well, you know, I came to the airport 2 hours early to get on my flight. There's an issue going on. There's something critical and important that you need to see someone, that you need help, that you need services, someone in your life, someone you're supporting, someone in your family. And so I started to kind of think about that and think about where in healthcare, where within DMH, where within our network of services that we provide, do we sometimes give the messages to people, I don't like lines, go away? Or do we make it more complicated? Or do we make it so you're going through a line after a line? You know that the line you're in isn't the line that's going to help you, but you have to be in this one before you get to the next one. And that makes me worry and makes me concerned. And as someone, and as Buddy said, you know, I have been in some of these back rooms, and what I like to, the role that I like to take is to try to figure out the practical solutions, kind of the operational stuff. It's not the exciting stuff, it is kind of the backroom stuff, but I kind of like to figure out how do we make ourselves work in a way that's a little bit better. But what we do as we do that work, and what I find myself doing, is we're threading between regulation, funding, policy, structures that have been in place for many years, politics kind of with a little p, all of those things. And it's kind of like, I'll use a Halloween reference since it's 2 days away. It's kind of like going through a fun house sometimes where you're trying to find your way through, and then all of a sudden, and I've had this experience in a fun house where like you literally like bump into the wall because you think it's a way out and it's just a mirror or, you know, something that's designed to kind of confuse you. And so that brings me really to why I'm telling you this story today, and what I really want to kind of share with you is that the role that you serve on the boards that you sit on is absolutely critical to giving DMH and the larger behavioral health community that 360 view of what the experience is like. All of you here are here because of your experiences and your skills, whether it's in accessing services, supporting others that are accessing services, or within your professional experience, or oftentimes a range of all of those. And we absolutely need to continuously have that 360 view, because otherwise we can get confused and lost as we're trying to navigate in this really, really complex web of structures that we're both at the same time trying to live within and break through so that we create a better system. The Southeast boards you have a reputation. You're known throughout the state. You know, when there's talk, you know, Jennifer just referenced it, you know, I'd like to take this to Western Mass. You have a strong history and a vibrant structure that through events like today are building on an already really strong foundation. You've done really important work in informing major kind of policy and programmatic decisions, reviewing data, looking at procurements, participating in stakeholder sessions, you know, talking about important things like housing, which is a big part of today. And I want to leave you with, again, kind of returning to my gratitude for the work that you do, and the promise that your work absolutely has impact in your community, in the area, and across the state. So thank you very much for having me here today.
Thank you, Beth, so much. Really appreciate that. And I, too, just want to thank everyone here today. And I greatly appreciate all the work that you do and the time that you give. It really, really makes a difference for those that we serve. So thank you for that. Now is the time that you get to hear all about what each site board is doing. So with that, without further ado, I will start with introducing Bill Tennant from the Brockton Site Board.
Thank you, Kim. Luckily for me and for you, Kim has put our accomplishments on one piece of paper, so I won't tend to wander. Wasn't mine. The site board members are also members of the Friends of Brockton Multi-Service Center and became the advisory board for the agency's PAC program. 5 members are on the Human Rights Board. The site board, Friends of Brockton Multi-Service Center, working together with staff and individuals, serve to help identify some of the needs and expenses that are not state funded, and addressing these needs. This is the hallmark of our site board. We funded 3 peer groups programs: the men's group, the Bible study group, and the arts and crafts group. Our client relief program funded 187 clients for utility bills, medical costs, transportation, driver's license, rent, bedding, housing, and clothing. Staff identifies the need and sends a request to the Friends for approval. We established and funded the agency food pantry. Our Thanksgiving program consists of 60 complete turkey baskets and $125 market basket gift cards, along with 50 $10 market basket gift cards that we give through the clients get directly. The client holiday party at the VFW Hall in Brockton served 180 clients. A 3-course meal and gifts were provided. Staff advertises the event and arranges for transportation, while the Friends serve the food and assist in the setup and cleanup of the hall. The client outing was held under the tent with 160 attending. The staff and the Friends cooked and served hot dogs, hamburgers, chicken wings, potato salad, and pasta salad. And I understand there were plenty of chicken wings. And lastly, staff and the Friends of Brockton Multi-Service Center worked together for a successful Friends of BMSC 23rd Annual Golf Tournament. Proceeds from the golf tournament fund these activities and programs. Thank you.
Thank you, Bill, so much, and thank you to the Friends of Brockton Multi-Services for all that you do. Really appreciate it, and especially appreciate the support with the ACE Awards as well. Thank you. So next, I would like to introduce Alan Burt, who will do the report for the Cape Cod and the Island Site Board, and also just to keep us on track, if each site board just can be brief, about 5 minutes. I think Jack's going to be our timekeeper, right?
All right.
Kim saw me, she thought it was important to make that.
Nothing against you, I forgot to say.
And if Kim stands up, it's time to move along.
That's right.
General. Cape Cod and the Island Site Board, Ray Caddy, our member who was going to do this, was sick, so she wasn't able to do it. So advocacy and monitoring. Advocacy and coordination of services with St. Joseph Homeless Shelter in Hyannis. We've taken that on, that we need to pay attention to the homeless, because many of them are mentally ill, as you know. Advocacy and coordination of services of Cape Wide VinFin Outreach Team, which is the outreach team that works with the homeless out on the street and in the woods. We've done advocacy and coordination with Belonging to Each Other, which is a winter shelter program in Falmouth. We've also worked with Homeless Not Hopeless, which is a 50-bed transitional housing program for the mentally ill and homeless. And I have a handout in your packet about that, and I'm certainly willing to talk with people about creating programs, grassroots programs like this in your areas. We've also begun to work with Martha's Vineyard, because they've got a real serious lack of resources out there in a homeless population that needs help. We've participated in contract reviews of the clubhouses, respite, ACCS programs, Cape Cod and the Islands, and we have representation in the Human Rights Committee, Cape and Island DMH programs. Community education, we created a partnership with NAMI. NAMI is such an important partner, and I was inspired last year by a presentation of another board for us to do that. So we have brought the NAMI president of Cape Cod and the Islands onto our board, which has been really, really meaningful. And so we did a community presentation on May 21st at the Cape Cod and Hyannis. The title was The Brain Matters, the Biology, the Misconceptions, and the Complexities of Mental Illness and presenters from McLean Hospital. It was just a wonderful, wonderful, informative, meaningful presentation that I highly recommend people contacting DMH on that because they know the presenters, and I highly recommend these community presentations like this in other areas. We have board representation on the Barnstable County Human Service Committee regarding youths and families in Cape Cod, because our mentally ill youth is a real problem area that we need to pay more attention to. We had board representation at Gosnell's legislative breakfast in Cape Cod and the Islands. I think we need to attend more of these type of events because we need to have more interaction with legislators. We worked on our brochure. We've developed that further. Professional development of our board. I'm waiting for Kim to stand up. I'm almost done. We continue to experience a very positive, productive relationship with our site director, Naomi Tavares, who is here, and just thank you, thank you, thank you. She is such an advocate, for the homeless. She's got, as all site directors do, a very difficult job, and we just feel really blessed to have you as our site director to interact with. We continue to explore how best to make recommendations to the area board and DMH administration. Towards this end, we've written letters to the area board and DMH administration and are pleased with progress being made in this area of our development. We continue to meet monthly as an advisory board as we believe that it's necessary for us to be well informed. In each month, our area board representative updates us verbally and in writing of what the area board is discussed and working on. Challenges: we need new board members, and young board members are board members in the 60s. We need to learn how to advocate more effectively with housing authorities, and hopefully Mark is going to be helping us learn how to do that better. Town officials, buildings. We need to devise and develop new strategies to better connect with other organizations to produce community presentations and develop resources and services.